just started my 2-minute timer. So this is 40% glycolic acid peel that's going to stay in your face for just 2 minutes. You might notice a little bit of kind of like a tingling, burning sensation. You feeling anything?
No.
Not yet? Okay. Might start to move it. Just going to put it all around your face. And what this does is it just kind of removes the outer superficial layer of your skin. Any tingling yet?
A little bit tingling, just here, this area. Oh yeah, I can feel it a little bit more now, spreading over, yeah.
Keep your lips closed, yeah.
And when would you expect to see results? Is it straight away or is it?
Immediately. You see results. So after we've taken the peel off, we'll put on like serum such as vitamin C that gets absorbed right onto the skin. So you see quite immediate results, like a glow straight away. Might get a little bit of redness, but that usually goes away in a couple of hours. And people usually have a course of like 2 or 3 to kind of get the maximum results from it. So you usually have the peel like every few weeks initially. There you go. Right. So now first I'm going to remove all the product before I neutralise it. Okay, just keep your eyes and lips closed. Feeling any tingling?
No, it's okay. I can feel it, but it's fine.
Yeah. Just help put any areas that you can still feel it, so I make sure I can remove all the products anyway.
A little bit on my nose,
yeah,
and a little bit sort of around here.
So this is suitable for a wide variety of people. Is there anyone that wouldn't be suitable for it?
It's suitable for everyone. The only indication is if they have an allergy to the product, which is very rare. Because it's a superficial peel, it's suitable for any skin type without causing any problems.
And so even those for medical conditions and those that are pregnant?
Yeah, it's completely fine.
How soon can you wear makeup afterwards?
The next day.
Right, okay. I'm not going out for the rest of the day.
So now I'm going to use a neutraliser, because we use glycolic acid. We're using an alkaline neutraliser to basically neutralise the product. We don't want any left on the skin, because if it's left on the skin for a long time, then that can cause a burn.
Right.
So we need to make sure all the products are completely neutralised. So the peeling is done. Oh, what's there another time? So the peeling is done while the product was on the skin. Because it's a superficial peel, there's no downtime, so you're not going to get any kind of flaking away of the skin. That's more with the deeper peels that you experience that. Make sure all the area is nicely neutralised. Any tingling anywhere at all? All fine?
Yeah.
Good. That's all the product going.
Actually, a little bit on my nose, just a little bit on my nose. It just feels it, not tingling, just feels a bit itchy.
Yeah, even if it's itchiness, let me know. It's the product that's causing it. Is that better?
Okay. Yeah, that's better.
Yeah? Okay. just remove that.
And so this is just cool water, just to remove the neutraliser.
Yeah.
And if somebody was to have an allergy, what would they experience?
Just normal allergic skin reactions, so they might notice like severe itching, redness, swelling, things like that. If you're going to react, it would happen kind of straight away, but I've never heard of anyone having a reaction like that with these kind of peels. It's normal to get a bit of like redness because we're just used to like 40% glycolic acid.
And the main effects of the treatments again?
So it helps to hydrate the skin, so it's a really good hydration treatment.
That's what I've just been told. I've
Yeah.
got really dehydrated skin. That's why I thought, oh, I'm going to go for this.
And it helps with like dull skin as well, so kind of just brightens skin, dry skin, and also uneven skin. So people with kind of like a bit of pigmentation, it kind of helps with that. People with kind of acne issues, it can also help with that as well. Just gives you kind of like a bit of a glow. So a lot of people that I've treated like brides just before the weddings, kind of gives you that glow and just looks really nice for your wedding. Right, so now what I'm going to do is apply the serums. So now that the outer layer of the skin has been removed, it'll be very absorbent. So first I'm going to use is a vitamin C serum.
So often when people think of a peel, they imagine something put on their face and peeled off like a mask.
Yeah. There are loads of different types of peels out there. They all work in kind of different ways. So the ones where it kind of really peels your skin away are the deeper peels. And that's for more kind of severe skin conditions like people who suffer from severe acne, hyperpigmentation. It's a great treatment for hyperpigmentation. So we do those kind of peels as well. But you have to prepare the skin first before doing those kind of peels, using products such as hydroquinone and retinol to prep the skin before doing those peels. But if you've never had a peel before, it's always best to start with a superficial peel like this, just to kind of see how the skin kind of reacts with that results. Getting this absorbed nicely into the skin.
And this would work well in conjunction with other treatments as well, wouldn't it? Such as the derma rolling and the MPL, the multipulse light treatments we do as well.
Yeah, definitely, yeah.
And even in combination with other facials as well, dermatological facials?
You have to kind of wait for a couple of weeks before you have another facial, because this is obviously just remove the outer skin layer, just so that you're not going to have too much trauma to the skin. One treatment that it does work really well in combination with is mesotherapy. And that's basically when you inject kind of small, tiny little into the skin, just back a millimetre underneath, products such as hyaluronic acid, ascorbic acid, and it just absorbs right into the skin, tightens the skin. So usually what we do is do the chemical peel and straight after do the mesotherapy, and that works as a really good combination treatment. So now I'm just going to put some rescue cream on. Okay, so this is just going to help with like the redness.
And how's that feeling now?
Yeah, it was fine, yeah. It's very quite relaxing actually.
Yeah, there's a lot of kind of stigma around the chemical peels. That's a traumatic experience, it's really painful. There are ones out there that are like that, but not all of them are like that.
Oh, it didn't hurt at all, even the tingly wasn't that bad, no.
It's just more of like an itchy sensation, isn't it? Yeah. And the most important thing is to finish off with a SPF moisturiser. Even if it is winter, you still have to have the SPF because there are still UV rays that have access to your skin. So just to protect it, because the skin is a little bit more sensitive after these kind of treatments. So it's important to use SPF. I'd always recommend SPF 50, especially for your skin tone. You kind of see the kind of glow straight away. Right, and voila!
Done.
Brilliant.
You can have a look in the mirror and you can kind of see the skin's already feeling a lot fresher and more.
I mean,